So really the purpose of why we're doing Peer Chat Live is to shine a light on peer support and better understand what it looks like across Scotland. So we have been chatting with people and will continue chatting with people who are involved in developing peer support, delivering peer support, who are involved in peer support, to understand, what it can look like in practice. And also just, provide a space to share some learning and experiences. So today we're focusing on peer support and services in crisis support. And towards the end of the conversation, we've got lots of time for questions and reflection. So really encourage you guys who are watching and listening to put in your comments and questions, and we'll pick them up later in the conversation. So I think we'll maybe just get started. So a warm welcome to you, Wendy and Louise. Thank you for joining us. I think it would be great if we could just hear a bit about the Neuk as a service, its journey to developing and that kind of thing.
Thanks for having us, Holly. We're really pleased to be here with everyone today to share the journey of the Neuk. I work for a charity known as Anchor House locally here in Perth. We provide services that are really just Perth-based, and primarily we're known as being a provider for homeless people in the area. And what was coming up time and time again was a real lack of services that were available to support people when they were having mental health crisis. And particularly support in a non-clinical setting, and people were having to travel quite a distance. Perth covers quite a large geographical area. People were having to travel, sometimes a few hours just to access services. So, fortunately, the trustees of our charity freed up some of my time to look at the gap and to develop the service, to develop the model. So that was in 2019. And things really happened pretty quickly. It was. We were approached by a local housing association and asked if we could do anything with this wonderful building that we have here at the Neuk. And this building is a 10-bedroom, was a 10-bedroom residential unit, big building, over 2 floors.
Yeah, there's space.
It's beautiful. I mean, look, I don't know if you could see how lovely this is actually my office that we're in. For years, my office has been a cupboard under the stairs.
You've upgraded.
Massively upgraded. Because space is we're really fortunate to have that here. So the Housing Association were really invested in their community as well, and wanted to be given something back. So it's Caledonia Housing Association, and they invested £150,000 into us as a charity, really, in the hope and the aspiration that we would be able to get this up and running as a crisis centre. So yeah, we had the building and we had the refurbishment. We had no funding.
So you had a reasonably good start, but then there's this big thing around funding.
We had a business. We had a business plan. We had done a bit of speaking to people locally, speaking to people that were already using our services, and also at the time there was an independent inquiry into mental health services in Tayside that identified huge gaps, and there was a group of people that came together that were using services, mental health services, and kind of brainstormed what they felt was missing in the area. So they really did a lot of homework for me, and I was able to pull that information when I was writing funding bids to try and get the service up and running. It was a real roller coaster emotions, thinking that I would have fun.
Tell us some of the learning and stuff like that around it. And I think that's a really interesting point about, the importance of reaching out to folk to get their ideas and that kind of engagement process to shape what things might look like. So tell us a bit of the learning. And you mentioned a roller coaster.
So it was a total roller coaster for me. And there was a few times I thought, what the heck am I doing to myself? It was real challenging. What we were finding was people were saying that they would invest in us, but only when we had a certain amount of funding. So I think this will be familiar perhaps in third sector organisations. And we really needed somebody to come on board with us so that other funders would take that seriously and really commit to us and our vision for providing this service. And so we were really fortunate that a local trust, for Teviot Trust, did that. I was massively interviewed and spent a lot of time in presentations and been on that huge emotional roller coaster. But so they invested in us initially, and beyond that, they agreed to fund some research. So they identified we can do our bit to actually help us to be more sustainable going forward as well. So if people want to visit our website, which is www.anchorhouseperth.org, and that document is there. It's called A Safe Place, and the researchers followed us for a year here at the Neuk last year. So there's people that have used our service. What makes us unique? There's loads of testimonials from not just people that use our service, but other organisations that we've built partnerships with. So that's all available there if people want to have a look at it.
And then is that providing you a bit of a platform then to be open to more kind of funding opportunities as a service?
Yeah. So the next biggest chunk of funding that came on board for us was the National Lottery. And that was absolutely brilliant. And that comes into the relationship that we built with the funding officer there, who just really totally got it and got the vision that we had, that people needed to be offered something to support their mental health.
And instant help.
And instant help.
Not waiting lists.
That's... Oh, Wendy, were you going to say something? Sorry.
So that journey, I feel like. So we were given the keys we should have had the keys to this place in April 2020. And for those of you that are listening, you'll know that was the sort of first major lockdown that we had during the pandemic. And so that delayed getting the keys to the place. So we got the keys in the June. But what that did between April and the June was we were able to kind of say to people, we are going to be here, and really build up that interest. Almost to day one, we had people turning up at our door.
Really?
Really. It was I guess COVID in some ways really helped to bring mental health to the forefront for people. So we see that COVID had a negative impact on people's mental health, but a positive impact in terms of allowing us to share that we were here and to open up our service and really to start making real changes in the community very quickly.
Space for that to happen, I guess. Can I ask you, I think people who are listening are going to be really keen to hear where the peer element comes in and the role of peer support, and the role of peer within crisis support. So I think it's a really interesting area for us to chat about. Tell me a bit about your thoughts on this and what does it look like for you guys?
I think for us, all our staff, there's a huge mixed bag, different kind of qualifications and skills and things. But ultimately, what we found over a period of time was to be able to completely relate to somebody, to have been through certain situations yourself and have came through things. It gives then people the hope so that they kind of feel they can get through it as well and be in the position, I suppose, themselves to be able to help other people going forward. I think it gets rid of that stigma as well. Sometimes I think it's daunting when you're in a medical setting to express how you really feel. Whereas when you come in to the non-medical setting, people don't feel judged. the feeling equal. And I think that's a huge part of peer support, is feeling equal to the person that you're talking to.
Yeah, it's the relationship, isn't it? You know, peer support is really about the relationship and the connection and the mutuality, which is slightly different from other kinds of support. And they all have a role, but there's something quite unique in that, isn't there?
There is an immediate connection that's there for people, isn't there, when they know that they're coming to an environment and a place where we've all encountered your own hurdles with mental health and suicide. It's the centre, when we first opened, we didn't really appreciate how much we'd be dealing with the suicidality for people in our community. But what became apparent really actually quite quickly was that as a team, we had all encountered suicide quite closely. And so we identified as exactly that, as peers, that we had that immediate connection with people. We were able to offer real empathy and understanding of what people were going through. And I just think back to times in my life when I've sought support from people, and it's always your peers, isn't it, that are the ones who you're around the most of the time. And you always look to people that have had similar experiences to get that advice and that guidance. So
it's refreshing as well, I think, when you speak to somebody and they can say to you, I know exactly how you feel, I've been there. And then when you're like, well, how did you get on with it? Can you give me some ideas how you got through this kind of time in your life? And again, it goes back to the whole hope thing. It's like, so it's somebody that actually really understands the emotion behind everything that I'm going through, rather than maybe just reading off a bit of paper.
Yeah. And I think, I was just thinking about that when you were talking, is just like, and before you had mentioned hope, I was thinking, you know, the thing that sits so centrally to what you're saying is hope. And then, and you've just mentioned it there. So, you know, there's some real like foundations that sit, you know, as part of the peer relationship and that offers something really unique. And so what does that look like within the Neuk? You know, what role does peer play, and what do your services look like?
So it's peer is everything to us, and it goes across all the service. So actually just this morning we were planning for a presentation that we're going to be given to an integrated joint board for mental health in our area, and we have peer support. We have wellbeing mentors, we have volunteers that, you know, undertake a variety of different things for us, pop-up events, you know, trying to reduce the stigma, get out there, raise the profile for the Neuk. And then we have peer ambassadors who have been through our service and who will come with us on the journey to tell their experiences of using the service. And so the bit that they're now giving back is as peers, you know, to promote the service for other people. So reducing the stigma and, you know, just inspiring other people with their stories.
And how would people access the service? You know, how so, you know, you said people will just access it themselves. You know, how generally do people hear about you, and what's the sort of trends around that?
So we do lots of different ways for people to try and kind of reach out to us. People can appear at the front door themselves. We do Facebook. They can pick up the phone. They can text message us. But we have got a fantastic rapport now where, like, your GPs, with the police, but also with different organisations. So I really feel in Perth we all work well together, don't we, to provide this huge service as a group, actually. So it's kind of group support for each individual. Almost customises it for each individual, because we'll bring them in, we do our initial contact, and we offer initially 6 crisis sessions. We then, through that, can evaluate each person and see what they're needing. And we try and then build a package around about what's going to be best for them. So whether it be something to do with recovery, whether it's maybe trauma counselling or hypnotherapy, whether it's something to do with housing, we all have different issues. So if we can't deal with it first hand, we then refer people on and kind of support them to get in touch with those organisations.
Yeah.
And how?
When you go, Wendy.
A lot of services that actually come in and they'll use the Neuk. So the police, for example, if they were to be interviewing someone that wanted to give a statement for, say, historic abuse from their childhood, then they can come here and do that because it's a safe space for them to do that. And so the police now do that, as well as other organisations. And then we have things like Citizens Advice Bureau that come in and work in here as well.
Yeah, so partnership, I guess, is key. And I guess I was going to ask you about, because crisis support is at a specific time in someone's, experience and distress. And I was going to ask, so how does it differ from other kinds of mental health service and support? I presume you will be supporting people at a point of immediate crisis. And I guess those relationships with external partners and the police and folk like that are really important. So would you mind telling us a wee bit about that as well? What that looks like, really.
What that looks like, and it looks very different for each individual. We might have people in quite high levels of distress that find that they can't even speak. We've had a young lady in once who, when we were speaking to her, she just felt that she couldn't communicate. And even, giving us the most basic information, she was saying things back to front. But identifying stress and how that contributes to people in everyday life has been a real journey for us in terms of how we communicate with people. So first and foremost for us, it's about making people feel safe. And we do that through offering cups of tea. We try and encourage that people see the space as being theirs and not ours. So people are encouraged to use the building in a free way and be going into the kitchen and making teas and coffees themselves. But it is really just sometimes about sitting alongside that person and listening and hearing what they've got to say.
Yeah.
And we find that usually within a couple of hours, that high level of distress has gone, and actually we can start the journey of how we support that individual.
Yeah.
And if it is safe for the person to return home, then that's usually that we'll facilitate that by taxis or whatever. And then we start to work at having them back in probably the next day and quite intensively, working on things like we'll have put an immediate safety plan in place, but we'll work much more intensively on a broader safety plan once we have people back into the service for us. Sometimes with physical touch, we'll cuddle people, and that reassurance. Nice, the words like "we've got you," and just listening to what people have to say.
That human touch, isn't it? That
connection. Yeah. And I think there's something really amazing about what you're talking about, that immediate space and what that feels like and how that feels different, to maybe other support. That it's about people just being able to be in the space, have a hot drink, be connected with and held, and held physically and held emotionally. I think these are all really powerful things to hear about the service. I'm just going to put a little call out to folk as a reminder that you can put in your reflections or comments or questions, because we'll be coming to that quite soon. I guess I'm conscious of the time. I feel like we've actually moved quite far on in time. We've got about 10 minutes left. And it's been great to get a bit of a sense of, what the service, how it developed, kind of what it looks like, and really the role of peer support and how, I guess, what's unique about the role within crisis support. And I just think there's something very powerful in what you're talking about in terms of the immediate space where people are held and supported. Thinking about the future, it would be really great to hear, what your thoughts are for the future of your service, but also the future of peer-led crisis support and peer support. So a bit of a wide conversation around looking forward.
So that's a really big thing for me. And I do a lot of work around trying to drive us nationally and hopefully globally, because I feel that there needs to be more centres like this. And actually, as a result of the work that we're doing here, we now have another centre in Dundee. And at the moment, I'm negotiating or having discussions with another neighbouring local authority. We would like to see this across Scotland. And equally, we would like to be bringing it to key and influential people to demonstrate that peer support works in crisis situations. It doesn't need clinical intervention.
Definitely.
And 97% of the people that come through the door, and just to say this year, that's been 460 people so far,
Wow.
don't need escalated to a medical intervention, and we can hold that person here and work with them on psychological theories and stuff. Quite not, we're not counsellors, but basic stuff, helping people with coping strategies, helping them to identify some of the behaviours that might be more challenging and how they can change things a little bit to support themselves a bit more as well.
Yeah. What about you, Louise? What's your hopes for peer support in the future within this kind of area of crisis support?
I suppose for us to be able to have more support, to provide longer term support for people. We've been doing a wee case study recently where we've done the kind of crisis side of it. A group of women who've then moved on to trauma counselling through our volunteers here. They then went to hypnotherapy. So all in all, they had about 8 months of peer support and other therapies. They've now done another 3 months of supporting each other and using again that peer-to-peer support to carry on for the following 3 months. And I suppose it's hard to offer absolutely everybody that with the resources and stuff that we've got. But it would be great to see going forward that we could provide that for most people if they need it.
Yeah, that sort of ongoing. And also it sounds like, what we've spoken about is support is very flexible and dependent on, what people need, but, being able to, provide a sort of longer picture of support, for folk. We do actually have a question, so I'm just going to throw it in there now, and we can come back to the chat about the future. But there's a question from Ram H, North Ayrshire Recovery and Wellbeing College, and this is: do all the staff have lived experience of recovery, and what are staff's key backgrounds and training?
So from a leadership point of view, so that's actually myself and my husband. I have extensively managed care and support services across Scotland for the last 30 years. And my husband is actually a tribunal member for mental health Scotland. So he sits on mental health tribunals. So that's that, for that point. But then, we have lived experience, of struggling with mental health ourselves and losing people through suicide that are close to us. And all the staff have lived experience, yes. They have lived experience of recovering from one element of mental illness or another. And that is one of the sort of key things when we're recruiting for staff, is we want that connection to be there so that people are obviously able to embrace the role here as a peer worker.
Yeah, thank you. I was going to ask something about the peer role. Now, I can't remember what it is, but it'll come back to me. Was there anything else in terms of the future that you'd like to touch on or share? You've spoken about really promoting the message of the role that peer support plays within crisis support. I think that's really important. It's something that we really advocate for. It's been great to hear some of your learning. And I think that kind of practical stuff, but also, the stuff that you've been talking about, the connection with people, the hope that, is shared and provided, and the connection. We've got another question here, and just to say, great to hear so many staff have their own lived experience. So what support is available for the peer workers? This is an interesting question. What support is there for the peer workers?
Peer support. regular supervision, debriefing. We're stepping out for a day on Friday. We're having a staff development, and team building day. We really look after each other. So
we are like a family. It's more like a family, definitely.
You could be sitting at
I feel like Yeah, just actually having this conversation with you two and the way you're sitting on the sofa together, you can tell that there is a close connection between you guys. A close group of staff, and so supervision, debriefs, team development sessions.
But we can also have, so it's trained trauma counsellors and it's a trained hypnotherapist / psychotherapist, and those are open to us whenever we need them as well, and we get instant access to that. There's no waiting list for that for us either.
Amazing. Do you know if there are any other projects like you in like elsewhere in Scotland or beyond, further afield across the globe?
So yes, so we're the flagship, and as I was mentioning earlier, we now have Hope Point in Dundee, which is run by Penumbra. So similar peer model, and as I was saying, it's my hopes and my aspirations to continue to promote that for other areas, and I would like to see it across Scotland. We've just got 3 minutes to go. So I wanted to finish up by doing a bit of a call to action. So I just want to say to folk who we haven't managed to touch on questions, we have one actually comment that says, "I'm relieved at the practical progress in action. Thank you." So just as we come to a close, if there are things we haven't touched on, we'll sort of strive to do that through our Peer Connects event. I'm conscious of time, and I wanted to pull the conversation together with a little bit of a key message, call to action. So Wendy, what would be your sort of key message for folk out there, your call to action, to the folk of Scotland and those listening? So my key call to action is for people to join us in making the difference, and for us all to stand together and to be exactly this, positively promoting peer support and really trying to make a change in communities where we are all actively supporting each other. Yeah, amazing. Thank you, Wendy. Louise, what about you?
I agree with Wendy. Let's support each other. Don't be precious about kind of what your remit and stuff is. If somebody could do something a wee bit better for service users, don't hold back about referring people and kind of guiding them in the right direction, but also, I suppose, for people to use the service when they need it. Don't be embarrassed about using it. We're here to help, and we really, really genuinely care. We're inspired, and we learn so much off of the people that walk through this door. I mean, just as much as they learn off us. So every person that walks in, it's a learning curve for all of us in here.
Yeah. Amazing. Thank you. And I really sense from this conversation that real kind of, commitment to collaboration and, networking, getting to know people, and the way that then that shapes things for you guys going forward. So we've got 1 minute to go. So I'm going to bring us to a close and just thank you guys, Wendy and Louise, so much for your time and for chatting with me. It's been a real pleasure. And thank you to folk for listening, for your questions and for your reflections. Some of you who are listening will be signed up for our Peer Connects event, which is happening next week. Wendy will be joining us there, and we'll also be joined by Ross and a few others from NHS Borders. So that's going to be a great event. I think we maybe got 4 or 5 spaces left. So if you haven't signed up for that and you'd like to sign up for it, please do. We'll be continuing this conversation and looking a bit more specifically around the roles within the Neuk, because that's not something we've been able to cover, within this short conversation. So we'll see some of you there, and, just keep an eye out on future opportunities, because we'll be continuing to develop this program of connecting and sharing over the next year. Our next kind of focus around sort of Peer Connects and Peer Chat Live will be peer support training. So if that sounds of interest to people, please join us again. We'll be shining a light on stuff that's happening across Scotland, having conversations, the things that we love. Find out more on our events and things like that on our newsletter and on our website and our social media channels. And thanks again. Bye.
Bye.